Okay, well, we may have a couple more join us on the line, and that'll be great, but we might as well get started. We've got a full hour, and hopefully we can use it to the best of our ability. So welcome, everybody, to this call. Today we're going to be showing you some opioid updates that we're really excited to show you. And we're lucky enough to have a few really super smart women on the call today to share some important updates. And so I'll start by introducing myself. My name is Nia Kavanagh. I'm a consultant with the EMA. And most people who are on this call today probably recognize my voice from the IF network. Currently, I'm working with the EMA to support the development of the EMR guides for all of the opioid work. And we have with us today as well Crystal Lacombe, who is the project team lead for the opioid response with the AMA. And as well, we have Wanda Trong and Bonnie Lacusta, and they are also consultants with the AMA, working on the opioid development team, supporting evaluation and measurement. So before we get started, I think I would just say that we really want to encourage questions from anybody on the call. So at any time, please feel free to chat them in on the line. And as soon as we have a natural break in showing the slide, then we'll make sure that we try to answer those questions for you. So please make a point to ask and take advantage of this as much as possible. So I think I'll start by handing it off to Wanda. Wanda?
All right, thanks, Mia. Welcome, everyone. Thanks for joining today's webinar. So the purpose for today's webinar was actually to gather everyone who has attended the opioid process improvement training, sort of as to follow up with you guys on the new developments that have been in the pipeline for the past couple months. We've had several questions about these new offerings, and so today is an opportunity for us to answer some of the frequently asked questions and for you to ask additional questions as well. Okay, so what's new? So today, what we have planned is a walkthrough of the new website and how to navigate to the opioid change package resources, an introduction to the measurement toolkit, including an instruction guide that's coming soon, an Excel tool, and a team assessment. Mia will talk about the EMR guides, and Bonnie will share more details on the demonstration project and the new videos that are also up on the website. Okay, so I'm going to start off with an orientation to the new website. This is just a screenshot. So the website is top.albertadoctors.org/opioid. And so I just want to emphasize that it's top.albertadoctors.org. If you were familiar with the old website, it was just topalbertadoctors.org. So I'm just going to navigate now to the website. All right, so once you're on the website, top.albertadoctors.org, you would go under Patients Medical Home and then Organized Evidence-Based Care. And so you'll actually see when you click on Patients Medical Home that everything is kind of organized under the Patients Medical Home elements. So the opioid change package is under Organized Evidence-Based Care, Primary Health Care Opioid Response. So here, if you see on the left-hand side of the screen, Primary Health Care Opioid Response, you'll find all of the materials and resources that were available on the old TOP website for the urgent response and the grant. So all of that information has been moved over here in these pages. And then the new section is under Opioid Change Package. So if you expand that, or if you go to the landing page, you'll find an introduction and a glossary of terms and acronyms. So if you look to the left-hand side of the screen, and if you expand that opioid change package section, you'll find that we've tried to organize all of our materials in a way that's in the same sequence as what you'll find in the IF binder from when you attended training. So hopefully it will all kind of look familiar to you. So if you go into each section, each page, it kind of has the same organization. So it starts off with an introduction to the section, the learning objectives for the section. You'll also find the training slides. So, and this is, if you click on the training slides, it'll just bring you up the slides from that section of training, and we've kind of chunked it out. So just going to show you a few more of the pages here. What we wanted to really focus on today was actually the opioid measures and EMR guide. So this page. And the videos are also new. So we've made some modifications to training based on feedback from our pilots and from evaluations. And so on the video page, you'll find some of the training modules from IF training that we've kind of reworked into pre-work modules for the opioid IF training. So for anyone coming into opioid IF training in the future, they can access these modules to do some pre-work just because they're a little bit more didactic, and we felt that the same information could be provided in a video format. And so it could also be helpful for you guys to share with others who maybe haven't gone to opioid IF training as well. So there are videos on how to engage your clinics, videos on ending stigma, and patient stories as well as clinic stories. So they're all located here. So the focus today will be on the opioid measures and EMR guide, and Bonnie will go through some of this in a little bit more detail later. Just going to go back to the slides now. Okay, so the measurement toolkit. So we've been developing an Excel tool that I'll be sharing with you shortly, and an instruction guide as well, which hasn't been developed yet, but it's meant to be an accompaniment to the Excel tool. It's more of that technical guide to help you understand all of the measures and how they're being calculated, and the team assessment. So I'm going to go through that in more detail now. Okay, so as you know, the change package includes the suggested measures for each potentially better practice, which is what this Excel tool is based on. And this tool is actually designed to make measurement easier. It's designed for you to be able to input data and to get automated graphs and analysis. And so it contains all of these process measures that align with each potentially better practice. This slide is actually showing you the data entry page, but please know that you don't actually have to fill out all of these measures in these cells. I know it looks like a lot, but it's a tracking tool, which means you can choose whichever measures you want to track over time. So each column represents a different time point, so you can actually track a baseline and then up to 6 time points after that. And here's what it looks like with some data filled in. So if you're only using, if you're only tracking, say, 2 out of 6 measures, then only those graphs will populate. So this is just an example of how it looks when all the data is filled in, just as a sample. And you can actually copy and paste the graphs to another application like a PowerPoint, or you can even choose to print the page. And the page is already set up for easy printing, so that's an option. So a lot of these measures are practice level measures, and they're based on a physician's panel. And so we're really trying to promote that panel-based care. It's also meant to be used with the EMR. And so for a more technical orientation to the tool, there is a 10-minute video that has been posted to the website as well under that video page.
Wanda, I'm just going to pause you there for just a moment. I was just going to remind everybody to please mute your lines. We are getting a bit of background noise, so that's just very helpful. Thank you. Go ahead, Wanda.
Okay, thanks. All right, so another resource that's available to you is the team assessment, which some of you have already been exposed to through training, and some of you may have been exposed to this through the PACT initiative. It's sort of the same idea. So this tool is also referenced in the Getting Started guide in training, and this guide provides suggested agendas for the first 2 meetings with clinics, and it's suggested that the team assessment be used during the first team meeting, as it provides a good basis for a team who is just getting started on this work. It could be used to help generate meaningful team discussion, for example, helping teams recognize areas where they already have strengths or potential areas for improvement. It might also help to uncover some differences of opinion among team members. I think the value of this tool is in generating that discussion and getting everyone thinking about the work, I guess, and where they kind of land on this 1 to 5 scale. So it's recommended that this tool be facilitated in a group with the QI team. And it's really meant to generate discussion, to come up with a consensus on each of these items. Okay, so I'm just going to hand it over to Mia if there are any questions from the previous.
So let's make sure that we, like anybody who has any questions, please chat them in. We really do want to answer anything that comes up for you, and we want this to be as helpful as possible. So I will, if you want to go to the next slide, Wanda, I'll go ahead and start talking about, we can always come back to if we have questions. So yay, this is my part. So now live on the AMA website. Please tune in. We have new EMR guides for the 5 predominant EMRs in the province. And so that is, of course, the 3 TELUS products. That's Wolf, PS Suite, and MedAccess, as well as Acuro and HealthQuest. Now, we have some very hardworking people who are putting last-minute content on the website. And so the MedAccess one and the HealthQuest one aren't quite linked yet, but they will be shortly. So stay tuned for that. Each guide is going to provide some workflows for providers and their teams. So it's going to give some recommended ways in which you can identify the opioid population, how you might build and track offers of care. That's sort of one of our newer buzzwords in the province these days. And also it talks a little bit about the quality improvement measures that you might want to do. Again, Wanda talked about how in her Excel tool, there's quite a bit of things that you could measure, but you may, in your team, you might find like maybe a handful of them particularly useful. Or as most of us know, when we're trying to implement something in a clinic, we may not choose to do things all at once. And so we might pick 1 or 2 measures and start with that and then build on that as time progresses. And also to be helpful with that, the EMR guides also at the last sort of segment of the guide has screenshots for quite a number of those measures that Wanda was showing in the Excel tool. So what's really helpful about that is that, we know we have to measure things in the clinic, but how do we actually build those searches? And what would we put in those searches to make sure that we have the logic correct? Now, the only caveat I would say, of course, is that we know that searches usually need to be built based on how providers and teams enter their data. So you have to take that into account, of course, but this at least gives you a place to start. Next slide, Wanda. Awesome. Okay. Templates and tools. So this is another challenge that we have. There is, of course, a set of tools that come along with doing the opioid work, and they include things like the opioid risk tool, the POMI, or some people call it the POMI tool, the new Alberta Care Plan template. That was the one that was developed by PACT, and so there's a lot of people who haven't seen that one yet. That's also located on the top website. Now I'm going to say I don't want to confuse people, the old top website, but if anybody needs to know where that is, then maybe we can find a way to get that back to you. So please throw that in the chat if that's something that you need to find. Also things like the brief pain inventory and then the cows and sows templates as well. Now, we are working really hard to get the POMI tool as well as the care plan template into the provincial libraries for the EMRs so that we don't have to worry about trying to build them ourselves. And I'm sure I can hear in my brain everybody who is like yahooing on the other side of this line. So that's awesome. We do not have a timeline for that yet because we're actually approaching all the vendors sort of in a combined meeting, and so it takes a little bit of time to get those things organized. But just know that that's in the works, and then I think that we'll be able to communicate that through some of the networks at a later time when that's available. All right. So next slide, Wanda. And Wanda, maybe I'll just get to answer a question here. Brittany was saying that it was that the Excel sheet was asking for a password. Oh, and Crystal answered. Excellent. Okay. So then I will continue. So this is just a screenshot. This is basically what Wanda was showing you earlier when she was navigating through the site. But as you look down at the bottom, circled in red, that's where you're going to find all the stuff that's related to measures and the EMR guides. Okay, and they're all linked at the bottom. The only thing I might point out here is that there's a generic EMR guide. And basically that's exactly the same content without all the screenshots. And so if you were wanting to show, it's about 7 pages long, so it's a much more condensed. And if you were wanting to kind of show a provider, for example, you just want to give them a sense about what you might be doing without having to show them all the screenshots, that might be a nice little document to show them, because then you can say, okay, so here's some suggestions of how we might identify the population and how are we gonna put that in our problem list and so on and so forth. So that just might be a handy little guide. All right, Wanda, next slide. Okay, so I just want to put a little bit of a plug in here. Some of you may have already heard about this, but it's going to be coming soon. So for some extra EMR support, just maybe think about and consider joining up with the provincial EMR network. I know many of you are on the IF network, and hopefully you're finding that extremely helpful. But there's also going to be a provincial EMR network, so it's going to be all things EMR. So hopefully we're going to be working really hard to learn and build and share things. So if you are brand new to a clinic and you haven't used an EMR and you're just learning how to use it, this is a resource you can tap into and see how other people are doing things. If you've been on an EMR for a long, long time, then it might be, you might be able to help support some people who are trying to figure things out that you've already solved problems to. Ideally, we want to build some relationships between people. So you make friends with if you're on MedAccess, then you make friends with other clinics that are on MedAccess, and you have a way that you can sort of leverage each other for help. Also, we want to just build on some of the knowledge and skills that are out there. We know we have pockets of improvement facilitators and panel managers who are amazing super users, and we want to tap into what they already know so that we're not reinventing the wheels, right? And then also we just want to sort of optimize our EMR. That's always one of our big goals. Maybe work at innovating some of those solutions around the EMRs and just looking for creative ways to solve some problems. So ideally, we're going to be launching in the fall. I think we're hoping for September, although, as we know, sometimes deadlines get pushed a little bit, but that's the goal. And that everything that we're going to be doing is going to be related to the 5 EMRs that I was talking about. We're going to have 5 specific EMR user groups. So that means there's going to be a MedAccess group, an Accuro group, a Wolf group, and so on. That way, when you sign up to this network, you can tie into one or several of these EMRs and just be a fly on the wall or be a contributor. It's up to you. So down at the bottom there is the email address. So if you want to express interest in joining, just know that send your email address in now. We aren't going to be doing a lot over the summer, of course. That's usually how things happen. But come September, we want to likely do sort of an introductory webinar, and it would be lovely if we had a nice big email list that we could fire that out to. So again, down at the bottom, emradmin@albertadoctors.org. Okay, I think that's it, Wanda.
Hi, so this is Bonnie Lacusta, also with the AMA. I'll just pause before I jump into the demonstration project section to see if there were any questions for Mia about the EMR guides. Okay, so feel free to chat those in, and I'll get started. So I've got a couple pieces I wanted to orient you to today. The first is the demonstration project. You may have heard about this in your IF training or heard, whispers out there and been wondering what the heck it is. So I'm hoping to add some clarity today. So first and foremost, the demonstration project is really an opportunity. So for teams that may be already doing some opioid process measure, that are confident in some foundational elements like having their panel identification processes in place, the demonstration project is an opportunity to access some additional EMR support to continue to optimize your EMR for measurement processes. In this specific case, it's around measuring offers of care. But to be really clear, it's sort of framed right now as if it's a different or separate project, but this is not a new ask or new work or anything additional being added onto your plate. If you're already doing measurement in the opioid change package, you may already be doing the demonstration project. So it's not anything different. It's the same change package, the same measurement toolkit, the same measures for quality improvement, the same tools. The only difference, and the reason why we're calling it a different project, is that in exchange for sharing some of your measures with us to help us fill an information gap, we're offering teams up to 20 hours of dedicated support from an AMA consultant around optimizing the EMR. So to be clear about why we're doing this or what that information gap is, it's around patient-centered care and making offers of appropriate care that align with a patient's state of readiness. So this project is going to help us understand how we can use the EMR, how we can leverage its power to document and measure offers of care. So next slide, please, Wanda. You may be asking, why would I want to measure offers of care? So we know that addressing the opioid crisis requires different approaches, and it requires several different offers of care, and a lot of the work being done in primary care is not adequately being captured by the outcome measure if we're only looking at patients who start on opioid agonist therapy. And so we wanted to try and fill that measurement gap and understand that there's a lot of work going into engaging patients, assessing patients' readiness and offering them levels of care that are appropriate for them, harm reduction around naloxone kits and offering naloxone kits, offering care planning and setting goals. These are all important incremental steps that may get us to that outcome measure of more patients on opioid agonist therapy. So we're hoping to fill that gap through this project, and that's kind of the primary purpose. So next slide, please, Wanda. So what does participating look like? So first of all, a couple points. It is at the physician level. So you may have more than one physician in the clinic who wants to participate, and that's not a problem, but it is based on physician panels. We're only asking for 2 data submissions. So there will be a baseline and then a follow-up, and that'll be 6 months after baseline. In exchange for sharing some measures with us, like I mentioned, we're offering 20 hours of EMR optimization support that'll help to get your EMR set up to collect these measures. And I just wanted to be really clear that this is not data for accountability or judgment. All the data is anonymized, so we won't be associating names. It'll be used in aggregate, which means all demonstration project participants' data will be pooled together and none will be individually identifiable. So the table there shows the 3 measures on the left column that we are asking participants to send to us, and this focuses on patients on your panel who have opioid use disorder, and then the number that have been offered opioid agonist therapy. We know that not all physicians prescribe OAT, so this could be a referral to a physician that does prescribe, so that counts as an offer, and then the number of patients with opioid use disorder on the panel who are on OAT. Any of the other measures included in the change package may be appropriate for you to track based on the process improvements you're implementing, but they're not required. So it's just those 3 measures that we're looking for. Anything else would be kind of the cherry on top of the sundae, but not mandatory. Next slide, please, Wanda. We have created what we call the participation checklist. This is just a tool to try to help you, the improvement facilitator, to keep track of the steps in the demonstration project. This may come in handy, especially if you're supporting more than one physician. This is not anything you need to send to us or share with us. It's simply something to help your workflow go a little easier. And I think that either is or will be soon posted to the website. Next slide, please, Wanda. So this is a busy slide, just trying to be really clear about what the demonstration project includes then. So there is a readiness checklist. This is on the website. This is a tool for you, the improvement facilitator, that you can do for a team or with a team, it's up to you, that helps identify whether a physician and his or her team may be a good candidate for the demonstration project. We are looking for people who do have some of those foundational characteristics like panel processes. They've got some EMR standardization processes or team-based care in place already. To be clear, though, we're not rejecting anybody from the demonstration project. There's no criteria you need to meet or set value you need to achieve. This is just kind of a self-assessment tool to help you identify the best candidates. There's also a very brief demographics form. You can see it in the upper right that just collects some really basic information about the physician's practice. Those two forms together, the checklist and the demographics, if they are emailed to me, and my email address is spattered throughout, it's on all of these documents, emailing them to me is your enrollment. That is the enrollment in the demonstration project, and that signifies to me that I'm going to set you up with our EMR consultation support and to get that process going. Once you've started that support and your EMR is set up to get some of these measures, we'll ask you to submit the team assessment that Wanda already talked to you about and your baseline measures. And again, it's not that entire form. It's just the 3 measures around patients with opioid use disorder and the offers of opioid agonist therapy. Next slide, please, Wanda. So that's kind of what it is and what participation looks like. And I think I've talked a little bit about why we might want to participate, but just to try to summarize here. This is setting you up to measure data that would be meaningful to your quality improvement processes, so it aligns with model for improvement and understanding what changes are improvements. It does align with making progress towards a patient's medical home. I think kind of the crux of it is it's contributing to filling that information gap, contributing to knowledge that we can use here in Alberta about the work being done in primary care, how we can appropriately measure it, and how we can leverage the EMR to do that work for us. It does help to build capacity at the clinic level with some clinic team members on how to really harness the power of that EMR. And like I've mentioned several times, you will have that direct support from an AMA consultant. I am going to pause here and ask Mia to jump in just to describe to you in a little more detail about what that support looks like.
Thanks, Bonnie. So really, this is an awesome opportunity, by the way. You know, this kind of support doesn't happen all the time, and so we're really lucky to have that. So what I'm hoping is that through that extra support, we'll be able to not only support the team, but also to support the improvement facilitator associated with that team, because I'd like to work with them on, you know, coaching either any challenges that they're coming up against, or maybe like any ways that we can tailor the work to the unique needs of the team. We may be talking about pacing or implementing the teams and sort of meeting them where they're at, but then working to build on their knowledge and their capacity and solve problems as we go. But I also really want to work with the improvement facilitators as well, so that you are able to go and take this work out to other clinics and spread the work. So ideally, those are the kinds of things that we could be doing together.
Great, thank you, Mia. So again, any questions, please chat them in. Next slide, please, Wanda. So this one is just a screenshot of our new website, highlighting some of the tools around the demonstration project. So the team assessment, the readiness checklist, the demographics are included in the readiness checklist. And then where the red arrow is pointing, where it says invitation to participate in offers of care, that is a 2-page document that essentially summarizes what we've just walked through. It's the what is the demonstration project, what's in it for me, and how do I enroll, or what does participation look like. So that's a tool you could certainly share if appropriate. On the right, you see 2 screenshots of some videos that we've uploaded to the website as well. These 2 are specific to the demonstration project. And the videos is actually the next thing I wanted to share with you. So you can go to the next slide, please. Again, this is a screenshot, and Wanda has already showed you how to navigate to the video section. The first 3 videos that you see are the new IF training modules that Wanda spoke about, but if you keep scrolling down, there are 4 videos uploaded that are specific to measurement and to the demonstration project. Next slide, please, Wanda. So I'll just go through each of them really quickly. We've tried to keep them all under 10 minutes. We tried for 5, but didn't quite hit it. Trying to keep them short so you guys have time to take a look. So the first one is just an overview of the opioid measures. So it talks about our intention in measuring process measures and how they relate to the outcome measures that the opioid grants are hoping to achieve. It talks about how the EMR plays a role here. We walk through an example. So again, just a quick orientation and broad overview of the measures that you've seen listed in the change package and how we've translated them into a tracking tool. Next slide, please, Wanda. The next webinar or video is a more technical sort of how-to. So this goes into the Excel tool and familiarizes you with it, shows you how to enter data and the fields in which you enter data, how to get those data visualizations, how to use them. It walks through, I think, 2 examples to show different setups. Yeah, so this one is definitely more of a technical video for anyone who needs some more support around how to use Excel. The third video, next slide please, Wanda. This one is more specific to the demonstration project. We actually asked Dr. Brad Baylor, who is a family physician in Sylvan Lake, to record this video for us. So it gives a physician perspective on why measuring offers of care is important, how he values that, and why he thinks this demonstration project is important to do. He's speaking with a clinic team in mind as the audience. So this video may be a tool that you would want to share with teams or use in one of your quality improvement team meetings. And again, this is the why is measuring offers of care important. And the 4th video on the last slide, please, Wanda, is the overview of the demonstration project. So many of the slides I just showed you earlier are stolen directly from this video. So it just talks about what is the demonstration project, what's in it for me, and then a really clear step-by-step instruction on what participation means. But again, just to kind of emphasize, the demonstration project is not really new work. A lot of you will be doing the process improvement, the measurement already. So this actually applies to people even outside of the demonstration project. Yeah, so next slide, please, Wanda. I think we're wrapping up here. We'd really like to hear your questions or your concerns. So we've left lots of time for discussion here. We do also recognize that in this opioid crisis work, there's a lot of work being done at a zonal level and at a PCN level to address this opioid crisis. So we do encourage you to speak to your PCN leadership and connect with your zonal committees to understand what local responses and local activities are going on to make sure that the work you're doing at a clinic level and your process and improvement facilitation is all aligning. We are also looking for you to help us and really to help your PCNs in your zones to identify those clinics who may be good candidates for the demonstration project. So those clinics who are maybe a little bit more advanced in their patient's medical home progress, who have some of those foundational pieces in place. If we can start identifying those clinics, I think your PCNs and zones would be interested in that as well. So if you have any questions at any time, my email is there. Please reach out to me and we can chat by phone or chat by email, or I can help to connect you with whomever is most appropriate. But yeah, I'll open it up right now for any reactions, questions, or feedback. Feel free to chat it in or come off mute as well.
So I hope people are feverishly typing in their questions. But I was just going to say that, you know, your questions might be around not just maybe what was in the content here of what we showed you today, although we'd love to know whether or not the content that we have showed is, if you feel that's going to be helpful for you. We certainly hope it will be. But the other part of this too is, you know, is there anything that you think you haven't heard about yet, or is there something that you think we do need to talk to improvement facilitators about? Is there anything that that we haven't showed you so far that you think could be helpful? So those are just some ideas about some of the comments you might make.
So I see in the chat box someone asked about scripts for clinic staff. Crystal, if you're still on the line, would you be able to speak to that?
Yeah, so I think the question was from, I just was wanting to clarify if there was a certain aspect of the scripting. Was it for when patients arrive, or could we get some more background on the question before I answer?
Probably typing in it, and that's the question from Edmonton Southside.
I wonder, scripting lots of different places in the opioid care process, so we could do it from arriving patients to prioritizing if they would potentially get same-day appointment books if they called in. You could use scripting with some of your language when you're handing out the different tools, so there's lots of opportunities there.
Front staff when patients arrive.
So when patients arrive. So I guess it would depend on the context of the appointment they're being booked for. So the short answer is no, we don't have preformed scripts, but this is one of the areas on our website, and it's you don't see this page being built yet, but what we're trying to do is build out a zone tab where there'll be documents that each zone can contribute and post. And so that would be a great one that I think we could look at prioritizing over the summer for getting on there as well too, because I could see how that could come in handy. I think for when patients arrive, one of the things that we do have is we have a patient outreach letter that talks about if we're calling in a patient for a reassessment who's on opioids already, there potentially could be some language from that letter that's on the patient handout section that might work, but we don't have a concise script developed to date, unfortunately.
So we have another question there.
If someone has developed that, though, we'd welcome the opportunity to share that with on the website and give you guys some credit, of course, and then also if that's still a gap this summer, then we can see where that can fall within our development cycle.
So, Crystal, I wonder if you could also speak to the question from Brittany about common exclusion criteria for searches. Example, patients with cancer, one-time prescriptions, dosages, types, et cetera.
Yeah, so the question about cancer is a really good one. So when we do our opioid IF training, that is one of the criteria, is the opioid work that we're doing is meant for just regular chronic pain. So it's non-cancer, non-palliative. So those patients would be excluded potentially from the searches. So again, it depends on how your clinic documents their opioid and whether it would be easier to search to exclude those patients, like if they're tagged in the diagnosis with cancer or palliative, or if there's another clinic process in place that could pull those patients out. Because yes, the intent with this opioid change package is for patients that are using it for chronic pain predominantly.
And that's a good example of how, you know, with some support from the EMA that we could work through some of those things, right, and really talk about how the team is documenting things. Just as an example, I had one clinic who said to me, or a physician who said to me one time, I'd really like to pull a list of all my patients who are low income. And I said, great, show me where you put that in the EMR. And he's like, well, I don't. And I'm like, well, then I can't really get it out for you. So it's so like Crystal said, it'll depend on how that gets entered in the EMR.
And maybe there's a scanned document that they're using a keyword that's being labeled in the chart as well too. That could help pull out some of those cancer patients as well too.
So Brittany also added to that by saying that that they also generally advise not to do outreach for opioid visits. Rather, just flag the patients to be seen by a nurse when they come in for a refill. Is that best practice?
So I haven't seen anything documented in terms of a best practice. Again, I think those are the important conversations that would come up and decisions being made at a clinic level. And so your team assessment, again, would be a tool that might start off some of those conversations if that's an area that you wanted to start with. So again, if the team doesn't agree with what the first step should be, whether it should be outreach with a letter or just when the clinic comes in, maybe there's a different area that they'd want to start with, because there's no right or wrong answer. It's whatever, again, that clinic context is really important.
Crystal, this is Sue. I just wanted to add to that. When Dr. Jessica Kirkwood was going around the province doing the OAT training, she did talk to physicians about those patients that you're thinking about right now and that you're concerned about, that you know who they are on your list, and maybe reaching out to them and having them come in for an appointment for outreach, because everyone could think of those patients top of mind. So Jessica was encouraging clinics to do that kind of outreach as a result of the OAT training.
Yeah, and that's a really great suggestion, Sue, because again, so that's where you might not need your EMR to pull those patients out, because again, the clinicians have those patient names top of mind. But yeah, then what is our team process for documenting that? Or do we put the opioid use in the problem list as recommended in the EMR guide, or what's the clinic decision? Because there's lots of different ways, and so our EMR guides provide one recommended solution that's consistent amongst the EMRs, but there is lots of different ways to document in the EMR. The main thing is that doing it in a way that's searchable going forward, so you don't have to repeat the work. Great questions.
Okay, so is there any final questions before we wrap up our webinar for today? Again, go ahead and scroll back through the comments here in the chat, because Bonnie's email is in there as well. Just in case you think of something later on, you're always welcome to send her an email for that. Okay, I don't know about you guys. I always find it hard waiting for 8. So if there's nothing else, oh, good question. Charlotte has a question about this presentation being posted somewhere.
Yes, so this presentation, we're recording it, so as long as our recording works, that we will be posting it in the video section along with our other measurement videos, and then we'll also post a copy of the slide deck as well there too.
We can get it posted to the IF Collaborative. Like you guys have, I think there's a website /SharePoint that Charlotte. So we can send this off to Lori /Leanne to also put a link there too.
Yeah.
For anyone who didn't attend training who might also want to listen. The real source will be on our website, though. Yes, we're working on that from a technical standpoint, Brittany, so thanks for flagging it. There's also a couple of other just very minor little YouTube things, et cetera, that we're just going to make sure are links. So thanks for flagging.